Hey, good morning. This talk that I give quite frequently has changed a lot over the last 6 months, and the factors involved with purchasing medical imaging have changed dramatically with COVID. Um, Number one, there's a huge pent-up demand for imaging. Imaging centers have been at about 50 to 70% capacity for the last 6 months. And patients are simply not getting the screening exams and the diagnostic exams that they need. And we know this because new cancer diagnoses are lagging dramatically compared to this time last year. And so that's factor number one. Factor number two is that claims are not being processed. When I'm looking at claims data right now, about 50% of claims are still hanging out there from 2020. And there are a lot of factors there, but one of them is the rise of private equity backed medical care. And that's really happening in the imaging space, both at the imaging center end where, some of these centers look like physician owned practices, but, it may have been physician founded, but they've got private equity backing at this point. So they're large chains of imaging centers that are in that category. And then there are what are called radiology supergroups that are a new phenomenon. 400 plus radiologists, some of them now in the thousands, that are private equity backed, and they're not going to settle for reference-based pricing 120% of the Medicare. They've got too many mouths to feed, too many people to be making a profit, and so they're going to cause a lot of noise in a healthcare plan. So those are factors out there that have a significant impact on what your company may be spending on medical imaging. There are a lot of different ways to make sure that patients get affordable medical care. And really the best way is to get them out of the hospital systems and into outpatient imaging centers. It's not always clear what an outpatient imaging center is, though. It may, be West Houston MRI, but it can still have hospital backing and care in a, whatever's owned by a hospital or wherever the physicians are incentivized or employed by hospitals, the cost of care is going to be at least 3 times greater than that with an independent physician or in an independent imaging center. And so the easiest way to hold down medical costs is to get patients to go down the street rather than down the hall for their MRI. If they go down the hall for their MRI in a hospital system, typically with the BUCA plans, with the Blue Cross Blue Shield, United, Cigna, Aetna plans, they're going to pay anywhere from $1,300 to about $2,300. There are exceptions to that. If you're at MD Anderson or Texas Children's, it's going to be dramatically higher. But if you're in one of the typical, not-for-profit hospital systems here in Houston, that's kind of the price range you're going to pay. If you go down the street to the imaging centers, pretty much roughly it's going to be $500 for an MRI. Through Green Imaging, we have some options that range from probably $250 to $500 for a non-contrast MRI in Houston. But that's a huge price differential. And it's there, as far as, people say, oh, the quality must be different. There is no correlation between cost and quality of healthcare in the United States. In fact, there's a little bit of an inverse correlation. So, Green Imaging, we're vetting these facilities. Now, we do have open MRI units in our network because people need open MRI units. If people have severe claustrophobia, if they can't lie flat, if they are obese or just have huge wide shoulders, a lot of times they can't fit in a regular MRI. So we do have those in our network, but our concierge service makes sure you get to the right imaging center for you. And so we have over probably around 1,400 imaging centers across the country now. How do we make sure your employees get to those centers? And there are steerage is a huge part of this. Access, making sure we have something near you is important. Patient experience is huge because you're not going to go back unless you had a great experience, and then that leads to lower cost for, in our healthcare plans, both the employer and the employee, because we incentivize, these healthcare plans incentivize the employees to go to the lower cost side of care. And the great thing about that is both of you are going to save money. You can offer these plans at zero out of pocket to your employees, and you're still saving, you know, a huge chunk of change. You know, these imaging centers are easier to access right now during COVID. They're safer. You know, this is not a hospital site. They're doing everything they can. They're, you know, widening the appointment times so patients are not overlapping and sitting in the waiting room. They're, you know, having patients wait in the car if it's not Houston Heat, you know, and texting them to come in for their appointment. We're doing all kinds of things to make sure these imaging centers are as safe as possible, because patients need acute care. They need cancer surveillance. This is a real, you know, it's a real shame that people are not getting the care they need. Typically in what I would call a virgin set of claims data, you know, our cost of our imaging is about 30% that of the overall cost in a healthcare plan. Even when we looked at healthcare plans, this was a national laboratory company who they already had cost containment in place. And we could still save them 41% with Green Imaging's network. This is a Central Florida school district. This is a Health Rosetta broker actually brought us in to this school district because the teachers union was very upset in that the increase in the Cigna premium last year actually wiped out the salary increase for the school district. And so this, you know, there are 10,000 covered lives here. Every student in this school district is considered economically challenged. And so this is not a rich school district, and they didn't have a lot to, you know, to offer these teachers. You know, they have to have health care. And so the first two steps they took were, number one, moving, thank goodness, the near-site clinic out of a hospital system and into Harris Rosen's medical center that he had set up for his own employees, the Rosen Center. And doing that at zero out of pocket for the employees, and actually adding on Green Imaging at zero out of pocket for the employees. And we estimated we would save the district about $1 million, you know, over a year. We were able to, this was our pricing prior to having those 10,000 lives. When we went in and renegotiated with the imaging centers, we were able to get the, you know, pricing down to this. And I think this number is going to be close to 1.5, 1.6 million for 2020. And that's despite COVID. That's despite, you know, about 50% utilization for 5 to 6 months. So, you know, we're very excited about these results. This is a situation where we've been able to, you know, provide something that's really impacting both the taxpayers and those teachers and employees in that school district. This is a larger set of claims data that came from Prater, from Bill Hennessy at Prater. This is 100,000 claims, Blue Cross Blue Shield nationally. And this just shows you the scope of a large number of lives and, you know, what the savings can be. This one is a national near-site clinic provider, and I'm showing you this just to show you that this is not, we've been in Texas 9 years doing this, but this translates nationally once again. You know, this is not just regional, it's a national ability to save. And this one is interesting because it's a reference-based pricing. We really kind of consider our competition, although we don't, to be reference-based pricing. And this was paid professional 120% of Medicare, facility 140% of Medicare. We were still able to provide savings, but what doesn't show here is that with these reference-based pricing plans to administer these, you're paying 40% of shared savings or 16% of billed charges, charge master rates to administer this plan. With Green Imaging, you don't have that. That goes away. And so these are true savings.
Hey, Kristen.
Yes.
Real quick, now these are fantastic slides, but and the emphasis being that by thinking differently about utilizing available health resources, could you say at a really high level, how does your service work if I'm an individual, if I'm an employee? Can you walk through that real quick?
Yeah, let me show you right here. Okay, so the way we work the best is if, and this patient was actually at the Rosen Center. So a lot of times we ask, if it's a provider, a near-site clinic, we ask them to have the patient take a snapshot of their imaging order with their phone and text it to our main number. And when they do that, that initiates the scheduling process. 85% of our patients choose to schedule this way by the the secure messaging platform. And so you can see here in about an hour, this patient, we've acquired all the information we need, and the patient has a voucher, has instructions for where the imaging will be performed. They have their prep for the exam, and they're ready to go. And, of course, we accept faxes, emails, web chat, web requests for patients to initiate the process. But, this is certainly the thing that has enabled us to say that this is easy now for patients.
Yeah, and can you go back to that slide, Kristen, where you showed the price between Blue Cross and you? Because I know you talked about reference-based pricing, and for our audience, that is, it's a way to use Medicare as a baseline for what we would consider fair payment. But in this case, most folks are probably using like a traditional health insurance company. And so I guess the point I want to make sure resonates with this is that if you look up to the left, you have the cost of MRI, CT, and the various other imaging pieces, the actual cost between what many people would say Blue Cross, they have the best quote unquote discount. Now, discount doesn't mean a darn thing in any shape or form, but just look at the relative difference. And the point is like, if you listen to your doctor and they're going to say, go down the hall. I don't know how many people I talk to, they say, well, I had an MRI. What'd you do? Went to the hospital. Well, that's a magnificent difference. And so what I'm hearing you say is you're empowering an employer and empowering a plan. And the way most people get your care, it's either free or substantially reduced cost to access you, right?
Correct.
You have an incentive built in place so that when a doctor says go down the hall, that's a trigger. And so that right there is a way to empower an employer to say, look at the difference. Would you rather give something for free at $550, or would you rather either have a copay for an MRI and it's $2,200? And so that, in terms of some of the mechanics of an employer-built plan, that's it right there. I don't mean to steal your thunder at all, Kristen, but I just want to make sure that point was echoed.
Great. I've got to scroll back through. And, I think we do really encourage people to, or health plans to at least pay for breast imaging at 100%, zero out of pocket, because that gets almost 50% of the plan members using us in a less stressful kind of healthcare situation, such that when they're under healthcare stress, they're much more likely to go down the street rather than down the hall. We do provide a lot of steerage. This is really important. Employee education. Right now we're already talking about, there is huge pent-up demand for imaging. Mm-hmm. When it's safe to be imaged, when you feel like your risk of being imaged, it outweighs the risk of COVID, you're going to need an appointment. And so we're really encouraging people to go ahead and get those appointments set up, so that, because there is going to be a shortage of the availability of imaging, especially mammography, in the coming months. And so I think that this is, definitely something. And so monthly we're bring up a topic like that, but we also have on this newsletter, we have a how to use us every month, so that's front and center with the employees. This goes out in the, early in the relationship, describes how to use us, what your employer is offering you, step by step, again, how to use us. And then, in the setting where you may not have as electronically savvy, a workplace, we've got postcards that can go out. We can do them in multiple languages. All of these things, we consider this to be a very important piece of what we do, because, certainly there have been companies kind of like ours who've had networks out there for years, but they don't promote the steerage. And, you can offer a discount, but if the employees aren't using it, it makes no difference.
So Kristen, you had a slide up that showed percentage savings based on steerage. Can you go back to that for a second? Sorry, I don't.
Yeah, right. Okay. So this would be an example. This is a small cohort. It's that reference-based pricing.
And so in this case, what I want to make sure that it's understood is that the employers, they have some opportunity to increase steerage by the rules that they set. And I like to say, if you write the check, you should write the rules, or at least not break any laws, but you should be able to significantly influence the outcome based on the rules that you set within the plan. And so in this case, I would imagine most employers start out by saying, you know what, let's just make it optional. Let's Let's promote the you-know-what out of it, make sure people are aware. But if you have the right third-party administrator in place, you could set some more stringent guidelines to either say, we won't approve an MRI at a hospital if it's something that can be done safely elsewhere unless you talk to green imaging, or you can mandate that somebody use green imaging in lieu of hospital. Is that correct?
That's correct. And I really like the option. I like, you know, zero out of pocket. If you use green imaging, you're subject to your copay and deductible, which are, you know, way up there if you go down the hall. You know, that gives, you know, somebody, you know, it may be an executive who needs to get it done today, so that they don't, you know, because they've got a conference tomorrow. And in that setting, you know, I do believe there should be an option, but that's out of their pocket, not the employers.
And I guess I just want to emphasize, when I look at from 25% to 90%, some of that you're not going to be able to affect the place of service for a variety of reasons, but some you absolutely can. And that's the strategic process of figuring out what's going to fit best within your culture. And it doesn't have to be a decision you make right now, but you start out with something and then you move towards something that might be more stringent or would guarantee, either by plan design or by the guidelines you give to your third-party administrator. Is that correct?
That is absolutely correct. And we think the number is somewhere around 90% that can be impacted. That's what we're seeing when we are basically mandated, unless it's an inpatient.
I just wanted to make sure when you look at that graph, there's not it's not an element of hope to go from 25 to 90% by promoting, you know what, that is a strategic dialogue that you can have as a plan, as an employer-built plan, and you can build the guardrails, if you will, not just necessarily today, but 3 or 4 years from now. Does that make sense?
That makes sense. And the great thing about it is when you look at and that kind of segues into, when you look at our reviews, you know, we hover around 5 stars. I can, you know, it is really worth looking at our Google reviews, because almost every time our concierge are called out by name, we provide better care. There's just frankly no question about it. You know, I spent half my day yesterday tracking down and, you know, 2-year-old MRI from Methodist Hospital so I could compare it to one of ours for a patient who had a presacral cyst. You know, we go the extra mile because we can. And that's, you know, that's when we get back to better healthcare. And the thing we haven't talked about is we're radiologist owned and operated. We have found a way to return to better healthcare where we're not managed by a hospital system. We're not managed by private equity investors. We do it ourselves, and it's so much more fun, and it's such a better way to practice medicine.
Yeah, and do you want to talk a little bit about how, I know you said for a member to engage you, they could send you the orders, but then what do you do to complete that?
Okay. What we do to complete that is we have, you know, what's called a referral management system. And so one of our concierge people are going to communicate back to the patient and say, you know, hey, we have, you know, what's your zip code? You know, what are good days and times for you to have this exam? You know, if they're cash pay, we'll also quote them, you know, what it would cost at each, you know, at 30 miles away, it costs this much, 5 miles away, it costs this much. And we, you know, initiate the conversation. They're going to, you know, just choose the facility that they want to go to. They'll end up with a voucher on their phone, or we can send a print voucher. In the background, we're talking to the imaging centers on this platform. And so it's an enterprise software system. And so we're asking them, do you have an appointment at 3 o'clock? A lot of times we toss it out to several centers, you know, who can see this patient most quickly. And, you know, somebody's going to respond. We're going to get them set up. The facility receives a voucher that confirms that Green Imaging is the payer. You know, there's no confusion when they get there and they try to give them their Cigna card or whatever. And the patient has their voucher to present that also gives them instructions not to present that Cigna card. And they're on their way to the imaging center. And usually, you know, it depends on patient response. When we started looking at, you know, we had employers who wanted to say, how quickly are you getting our employees scheduled? Well, it's super quick if they respond to us. If they don't, it's problematic. And so, you know, that's not something we typically quote.
Understood. And I guess I wanted to make sure that you weren't just sending people to a website and saying, do your best. You're actually completing the service. You're making the appointment based on feedback that you get from the individual, of course. But you're not just saying, hey, go to a website, print something out. You're providing a concierge service where you're fulfilling a need, because it's really convenient to go down the hall at a hospital, although it could be costly. So you have to take some of that element of managing the experience off of the individual's hands to make it easy for them. Because they may not realize, I can go 2 blocks away for the same dang machine. And then you guys, do you provide interpretation services as well?
Yes, we read about 80% of the exams performed in our network. And so if we have the population density in an area, in a state, we actually go get our licenses there and provide the service.
Okay.
That's how we, assure the imaging quality and the report quality across the network. Where we don't read the study, we actually have peer review access. And that's why, the radiologist owned aspect of this is so important. Where if there ever is a question, I've had it happen one time, where I've had to go in and look at the images and report. And in that setting, it was fine. The patient had moved on one sequence. And so, we gave the patient the option. I said, it's still a diagnostic study. We gave the patient the option of repeating that sequence, and she elected not to. But it was reassuring to her to have another doctor go in and take a look at it.
Okay. Last question I have, Kristen, where is your footprint now across the country?
I had a slide of that somewhere, but I don't want to have to go back. We're national, a little lighter in the Northwest, but we just yesterday were given a huge book of lives in that area. Mm-hmm. So we really have a great national footprint now. Where we don't have an imaging center and we have a direct contract with an employer, we actually go shop for care for that employee because we're the experts in doing that.
Oh, cool. Thank you for that. I think those are the questions that I've seen come up. And so just to summarize, Kristen, was there anything else that you wanted to make sure you echoed in your presentation?
No, I think, it's a complex subject, and I'm happy to take questions afterward, or, anybody can follow up with me with questions. Because it's not something that's intuitive. This is not how healthcare has been delivered nationally. And like you say, it's also not an app. We're trying to do it better. We want to be everybody's best healthcare experience ever, and we get reviews that actually say we've been the patient's best healthcare experience ever, and that's our goal.
And so for an employer that says, okay, I'm with a fill in the blank, a BUCA carrier. And then not necessarily wanting to change that right now, what's the best, how do you typically work alongside that type of
That's really the best news is that we can get you on board next week. It's a bolt-on plan like vision or dental. We can bolt it on at any time. We don't have to wait, for re-enrollment. And literally we get employers on within a week. And those savings can make a huge difference right now. It gets a little more complicated when somebody has a qualified high deductible healthcare plan. That's the issues there. Yeah, would be a much longer discussion. But for a typical self-funded, or just a typical healthcare plan, a typical insured company, they can offer this to their employees, and they're doing it all the time as an added benefit right now during this crisis.
Okay. Well, thank you for that, Kristen. And in terms of the overall impact, what should, if somebody decided wanted to do business with you, what would you expect with minimal involvement as a percentage of spend, if you have a number offhand?
I would say you can decrease the imaging spend by 60%. You can decrease the overall spend. It depends on what you're spending, how much is going to a hospital system. But I would say 5% is a conservative, very conservative estimate. And that's, but we see it all the time. That's without a lot of extra energy.
Okay. Well, I would just say if you're an attendee and you're listening to this and you're all interested, there's some simple reports that you can ask for from your insurance company or your administrator. And it would allow Kristen to do a scenario analysis saying based on a light level of integration to full on, we're going to write some more stringent rules, be easy for her to estimate the impact that she can have on your lab spend, and more importantly, the impact you can have on your employees' lives. I can tell you, I've seen in people's faces when you give them this option of saying free or significantly reduced, and they don't have to choose between rent or food on the table and healthcare. It's a huge sigh of relief that they give as well. So Kristen, thank you for everything that you do. Sincerely, your company is beautiful, and it's a pleasure to even be in the same room as you are, even though it's virtually. So thank you.
Thanks for having me, and thanks for getting the word out.
My pleasure. Now I'm going to transition to Sean Rutledge, who's been sitting